All right, hey y'all. So I created this video to essentially show the EMR system, or rather the system that I envision us using with Stop HIV ATO. And so after doing some snooping around and shopping around, I came to the conclusion that it would be a good idea if we use short forms. And Latino Link currently has a yearly subscription because we use short forms for our HIV testing efforts, and so we have the HIPAA compliant version of it. And so we found this very helpful for us because we used to be a nonprofit that would hand out paper forms and then fill them out, and then later we will, upload or essentially like do data entry on an Excel sheet and then process data and show results, which was a very inefficient process because it has to go through paper through every document and then make sure everything's correct, and so it just really wasn't efficient. So I came across Jotform, and yeah, pretty much developed our own little system. But what you see here, right here, is it's a mock-up. None of these patients here obviously are real. These are all just made-up names that I came up, and these are all just made-up entries that I have fabricated. So what you're looking at now here, what you're seeing here, is essentially the form that I created, uh, which is here. So what you're seeing here is this, but just in rows and columns. So I imagine that one of two things will happen. Either whenever the client wants Health Navigator resources, if they go online and they fill out a form, let's say that it's this form right here, they fill it out, they put their name, date of birth, or really whatever the questionnaire form that you may have that you want me to use. I will essentially copy and upload it here, so it looks like this. And so after they indicate the services that they want and everything, then they'll click submit, and I'll just say, okay, thank you so much for your submission. And then two things will happen. First of all, I will get a notification from Jotform telling me that somebody has submitted the application. And then the other thing that will happen is that I will also get an email to my Latino Link email letting me know that somebody has uploaded an application. So in this case, so let's just say that Martini Rangel just submitted the form. So when there's a new form submitted, it will look like this right here. It'll look just like this right here. And what would happen is that the first thing I would do is that I would just give it a quick EMR, like a quick little chart ID number, just to keep track of where we're at. Now, the progress report, this is where I start to indicate where I am with the client when it comes to the referral. So let's say in this case that Martini Rangel indicated that he wants resources for, he wants to get prep. And after reviewing his chart here, so this is what it looks like. This is more in depth. It's pretty much the form that he filled out. Except here, I get to indicate more precisely the progress, the referral location, and then I can also put like notes here. For example, let's say that I spoke with the client and I told him that, okay, I spoke with the client, and client needs STD testing results, STD testing services, sorry. And then 2 days later go by, and after communicating with Positive Impact Health Centers, because that's where I thought might be the best place for him because he lives in Decatur, and so after talking with Positive Impact and talking to the client, both have agreed everything's fine. So in that case, then I would what I would indicate here is that the referral has been confirmed, meaning that everybody knows what's going on. The confirmed an appointment has been made, or the client has gotten resources to go to a clinic for services. But like if I'm just having an initial conversation about what their services are, then it will be indicated as this. So there are a total of five progress steps here. The first one is contacted but not answered, meaning that after they fill out the form, I call them, but they didn't answer me. So I would click here, and then I would go to their charts, and I would indicate that. I would make a note saying that the client didn't answer me. So I'll just type that out. I'll just type that out right there. And then and as progress is being made, and after I've spoken to the client, understand what their needs are, then I'll just go here, click referral initiated, and once appointments have been confirmed, or perhaps if the client has received the information that they need to go to a particular location, then I'll click referral confirmed. If the client actually attended, then I'll indicate that, or if a referral was canceled, then we can also indicate that as well. So in this case, let's say the referral was initiated, And because this client lives in Decatur, let's say that I sent them over to, I don't know, Positive Impact in the Decatur office. And it's for, so it won't be for that. It would actually be, I think that, yeah. So let's say that it was actually for STD testing. Um, so yeah, so then that has been already, so I have that here ready. So this is where we're at. And anytime I make a modification to the patient's profile or to their chart, that gets reflected here. It just lets me know when it was last updated. And then, yeah, and if I want more complete information about the patient, I'll just go here. And essentially, if I need their address or phone number, emails, that can all be found there. Now, on the data side of things, so with drop forms, the pretty cool thing about it is that using a filter, you can actually sniff it out data. So what you're looking at here now is pretty much just the overall submission. So if I was asked, okay, how many submissions did we get in March? So I would pretty much just be showing you this report that we're looking at now. And I would tell you that, well, 7 males and 4 females. This is by their race and ethnicity. This is by their martial status. Not that matters. I can tell you how many of them prefer English or Spanish or another language. And then this is when we get to the meat of it. And I can tell you that, okay, well, and this month we had a total of 7 STI, STD referrals. So we had 5 PrEP, 2 mental health, and 1 for general healthcare services. And so this is all reflected here. You can also modify these to make them shorter, make them more nicer, more aesthetically pleasing. And then this here kind of just divides it by like the locations of where they live, where these folks are. Yeah, pretty much where they live. This is not showing where they are getting referred to. And in order to do that, I would have to manipulate the data, the filters here a bit more. And then here, like, if you ask me, okay, how many referrals did we? What were the referral locations for the month of March? And then here I would just show you this here, and this is how many referrals we did to Positive Impact, to Mercy Care, to the Feminist Center, Ponce de Leon, and so on and so on. And then here just pretty much tells you like where we are at this month. If you ask me, okay, well, what is the progress of the referrals? I would tell you, well, right now we have 4 referrals initiated, we have 3 referrals confirmed, and we have 3 clients who have attended, have notified us, and we have 1 referral canceled. So yeah, pretty much this is just like the grand view of it. The one thing that I'm still playing around with here is on manipulating the data. So for example, what I mean by that, for example, let's say I was asked, okay, if I was asked, okay, how many Hispanic or Latinx folks reached out to us for PrEP? So for me to show that in a single chart, it might be a bit tricky just because as nice as JotForm really is, sometimes it has its own limitations as well. Just like when I used to work at a clinic, we used Athena, and whenever we had to run monthly reports for billing, sometimes the physicians would ask me, okay, can we run a report and let us know how many Latino men did we diagnose with the type 2 diabetes, hypoglycemia, for example. So then in that case, I would have to run a report with the ICD-10 code E11.64, which is diabetes type 2 with hypoglycemia. And so, in those particular cases, it was pretty difficult to use Athena solely to generate that kind of data, just because Athena just didn't really support all that infrastructure. And then I think from my experience, some EMR systems may not be so kind to developing those kind of that data, not because they have something against it, rather they might not just be built for that. And so, however, regardless, if I'm being asked to, if I'm being asked to generate a certain type of data and job forms can do it, then that's totally fine because I can just download the forms, I can just download the data, and then upload it to like an Excel sheet, and then just manipulate it there, and then just generate more results as well. And so, yeah, so this is pretty much just an overview. I'm still kind of working out the kinks, some stuff here. It's not perfect. It's much better than what it was a few days ago, but Latino Link, we use something quite similar where anytime you go and do HIV testing, it looks just like this, except there's less questions that we see here, and it's we also can record if an HIV test has been positive or negative, and so we'll indicate that here, and we also give folks the option if they want a copy of their results and how do they want that copy, if they want it in a physical piece of paper or they want me to email it to them. However, if it requires me to email it to them or text it to them, I'd rather do it at that point in time when we're in the same room, so we can discuss and prevent information being leaked. But I do want to say this is that um, the security that we have with Latino Link regarding everything that we do, it's like three layers. The first layer is that all of the devices that we use, including from my personal phone to the tablets, to computers that we use for HIV testing and data collection, they all have password protection, and some of them are even require a two authentic passage. The second line of defense that we have is that we use VPN services. And so, especially when we're in public and we're using like public Wi-Fi or perhaps like the hotspot for my phone, we use VPN. My phone itself also has VPN. All of our devices have VPN services to pretty much provide the extra layer of security. And then the third layer of security that we have here is that um, JotForms, the system that we have is the HIPAA compliant version. And so, which means that all of this data that you're seeing on your screen right now, it's being stored in HIPAA servers from JotForm. And then on top of that, just to log into JotForm, the only person who has access to this right now is me. And right, I'm working on giving access to my other health navigator, Cote, from Latino Link, because he sometimes helps me out. But even then, just to log into JotForms, it does require a two-step authentication. And so the security is definitely there. And so it's the potential. And so, yeah, let me know what you guys think.